Boom. All right. We are live. What's up, everybody? Joshua Smith here with my good friend and business partner, Jim Brown. We're here with another weekly live FORJ Life podcast where we come at you guys every single Wednesday, at least from a live element. Of course, you can see this after the fact on YouTube, on Stitcher, iTunes, or Facebook channels, and so forth. But every single Wednesday, 2:30 p.m. Pacific time, 5:30 p.m. Eastern Standard Time, we come live. If you ever want to tune in live, ask questions, engage with us, we're here, we're live. And today we're here to talk about something that is massively important. It's always been important, but it could arguably be more important, more so now than other times, which is the importance of taking care of your health and taking control of your health with everything that's going on right now. When I say everything that's going on right now, what are we? August 11th, 2021, different variances of COVID-19 now that we're seeing. And, this is something that's, impacting all of us. I think we've either personally been impacted or know people that have been impacted. And just talking about, one thing that is never talked about with this and throughout this, and I don't want to say it's never talked about. There's other, YouTube channels and some influencers out there that are talking a lot about this, but I'm talking from the mainstream, is how to go out there and be proactive with your health. And it's interesting, Jim, when all this first came about, almost 2 years ago, I reached out to some of our mutual friends, some brilliant optimal health physicians and so forth. And I just asked them, like, hey, what's your 2 cents on this? What do you guys think with this? And across the board, everybody that I talked to was just plan on getting it. Hope for the best, plan for the worst, but plan on getting it. And if you're going to get this, how then can you be proactive? So then if you get it, you don't know you got it. Or worst case, you're maybe down for a couple of days like a cold, but you're able to go out there and beat its ass. And, there was just some common things that seem to I guess hinder people in different ways if they're not proactive with their health. And we're going to get into all of that here on with what we're talking about today. And the purpose of this, you guys, is not to make this, anything political, any of that. I'm not personally a dude that gets into politics or it's not about that. It's just to have an honest conversation, discussion. When I say honest, right, Jim and I aren't doctors. We're not claiming to be doctors. Just giving our 2 cents on things that we've heard, things that we're doing personally. And Jim has more experience in this than much more than I do, not just from a health and fitness aspect, but he's in the hospitals every single day. That's what he does for a living. So with that, man, first off, dude, like, what are you seeing right now, Jim? Because you are like, your job is you're working with doctors every single day in these hospitals, in the ERs, in the ICUs and stuff. And sometimes what we see isn't always the same thing as what we get and we hear on the media and so forth. But what are you seeing going on right now?
Well, it's really difficult to get, relevant information. Some of those centers that some of the hospitals that I deal with are very large, let's just say like hub model hospitals that have patients that are very sick transferred into them. So those places are jam-packed, very busy. There's definitely a lot of COVID patients. I do think that some of the hospitals are full and overrun, but an ICU on any given day is supposed to be about 80-85% full. Otherwise, it would be hard for the hospital to make money. And so, when they have proactive procedures and normal business, they're going to have so many patients in the ICU as they expect. When you have an inflow of sicker patients like this, like maybe a heavy flu season or what we have going on right now, and some of those beds are taken for those patients, then the people who would kind of normally flow in through, regular business and some of the, maybe elective or scheduled surgeries that were going to be in the ICU can't do that, or they're backed up and they're full and there's no beds. I think the largest hospital that I personally know of, I don't think the ICU bed is, they might have 30 beds total, but that's a very large hospital. And I could be wrong. There's a couple of different step down floors and so on. But anyway, the big centers are very busy, yes. I don't know anything about the patients or, anything like that, if any correlations. Only what I kind of see on the news and it's really hard to get information that I believe is unbiased or, not kind of skewed to make us feel or do something. But that being said, there's a big second wave going around. People are getting sick. Early on, though, kind of to your point, I knew that I was going to be exposed to the virus just like flu season. If flu season happens, I know I'm going to be exposed to the flu virus multiple times, sometimes multiple times in a day. And so what's the best thing that I can do? Or even now, what's the best thing? I know I've been exposed to COVID. I know I'm going to continue to be, whether it's in the grocery store or at work or whatever. And so I try to maximize everything that I can do to make sure that my body is ready to fight that, when it's going to be exposed to it. And I'm not the type of person that's going to live in a bubble. I don't know how effective some of the masks people wear are, inside and out, and then the rules where you walk into a restaurant and take your mask off to eat and all that stuff. I mean, it's ridiculous to think that that's protecting you. What's really protecting you is your immune system. And if that's shot, then you're probably going to get it. You're going to get it, and it's going to hit you hard, harder than somebody that has a functioning immune system and takes care of themselves. That's my opinion. And I believe that some of the things that we're seeing overall with all the patients who, we've seen get it and recover or not recover. Certainly age has a very strong factor in that. The older you are, the higher risk you're at. And typically that's associated with the health of the patient too, right? When you're 70 years old, there's a lot of things that can happen, and you usually have a couple disease or comorbidities that are not end stage, but been there for a while. You have developed diseases that you're dealing with. Typically, my dad got it last year. My dad, my stepmom, they're 73 and 74. And, my dad counts calories every day. He's pretty lean for a 70-year-old guy. He has a little butt, a little belly fat like most old guys do. But he exercises like a madman. And, he beat it. My stepmom, same. Didn't even know she had it. Beat it. She's active. They're not obese. They take care of themselves. And that wasn't the case for a lot of people in their community who were overweight and maybe diabetic and had other more serious health conditions. It hit them really hard. So that being said, let's talk about some of the things that we've done to kind of supercharge our immune systems or make sure that we're apt to handle it when we get exposed to it, because we're going to continue to be, and we have.
Yeah. And then just, for those that are tuning in or watching this after the fact, again, we're not trying to come at this from taking a stance or not having a stance, or you're trying to be pro-vaccine, anti-vaccine, or having any, not making this political by any means. It's just, again, having an honest conversation about things that can be done potentially to go out there and be proactive with this. And I think this is important. When I say the whole, vaccine, like you've gotten the vaccine, right? I personally haven't, but I also don't work in the hospitals every day and work with doctors like you do every single day. But regardless whether you get it or don't get it or whatever, we're seeing people that have gotten it re-get it again, right? People, so regardless of whatever route that you go, you still are at risk for getting the vaccine. I'm sorry, for getting COVID again, or having, whatever at risk, however you want to quantify that, so what we're talking about here today is whichever path that you choose to go there with that, you still need to be taking care of your health. And there is a direct correlation with, like you mentioned age, which we can't always do something about that, but is it age, or is it just that when we tend to get older, our health tends to decline, right? So is it age, or is it just, as you mentioned, that the weakened immune system and the weaker health at that point? There seems to be a direct correlation with vitamin D. There's vitamin D3, and I'll kind of go into some different things and advice that I've been given and to get your 2 cents on this, but there seems to be a very high correlation with body fat. And I don't know if you're seeing that. Are you seeing that? Because you've seen this all the way through of when this first hit, like you've been, and again, when I say seeing this, meaning that you're working with doctors. You have products that you sell doctors that actually are products that they need to utilize through this whole pandemic, so you've seen the influx of patients and through the waves of lifetime of how that's impacting hospitals, at least in your area. But have you personally, because again, we hear things, but what we hear isn't always what we then see in real life. Have you seen there to be a direct correlation with body fat and how this pandemic, COVID-19 virus, whatever you want to call it, how it hinders, and the impact it has on you?
I haven't really had those discussions with the guys who take care of these patients, to correlate or to try to, see if I could ascertain any patient information or see anything that they would run as, some commonality. So I'm not really sure, and I would feel uncomfortable, commenting on that personally. I'm not really sure. I'm not in that position. These guys are overrun, and my job is just to get them the best equipment and the supplies they need and help them do their job. That being said, all I can tell you for sure that I've seen firsthand is, we're busy down here right now. We are, according to the sources that I've read independently, yes, I think that's true. I think we've seen that overall, a lot of the patients that are going to suffer the worst side effects from this and the worst effects from COVID typically tend to be obese. And I think there was just a paper or some data released that had a number assigned to that. About 78% of people in ICU that were in serious condition from COVID were obese. And I don't know what the obese marker is, if it's a BMI level or exactly what triggers the word obese being used in that. But yeah, we could say that they have excess body fat, probably diabetic or pre-diabetic. I have seen data that suggests a lot of people that suffer worse or the most harsh conditions from COVID had low D3 levels or low vitamin D levels, insufficient levels of that. And I think we can kind of, if I'm putting together a protocol for myself, I try to take in that information. A lot of the people that I work with at the hospital just see a lot of sick people. And so it's hard for me to say, to come up with anything with that. But that's like anything. You ask, well, what's a typical heart patient look like? And that's, it's really hard to get, that's why we need data. That's why we need, to have stats that we can see and kind of see from all around that aren't biased, and it's hard to get that information, I think. But that being said, I think having your D3 level checked is very important for immunity anyway, but especially now. I think one of the things that you can certainly do for yourself is take one of the cheapest supplements that you can buy would be D. Blood test for it is $20 to see where you're naturally at and how much you have to supplement. Anybody, and I don't care who you are or what you've tried before, I am 100% certain that anybody can reduce body fat, especially if you have a lot of it. It can be done. You can do it. And in the process of you doing that, you're going to immediately affect your health in a positive manner. And what we think right now, is that going to help you fight COVID off? From everything that I've seen, I would say that that's a pretty damn good bet. So those are two things for sure that I think we could probably agree on that that's a good idea to do. You can't change how old you are, but to that point, my dad is an old guy that works out and keeps his body weight under control, and he drinks a lot, but keep being out in the sun, exercising, and having low body fat seems to be something that is very conducive of surviving this. So.
Yeah. And to your point, dude, with data and studies and research, it's like, I heard and again, I didn't go fact check this, so I don't know if it's accurate or not, but it was something like 78% of those right now in ICUs due to COVID are obese, right? Well, then I'm like, okay, well, what percentage of the human population is obese, right? So you start, if 80% are overweight, over 50% are obese, then like, is it like, again, you could, the problem with data is, until you really break it down, every piece of it, it can be easily skewed or portrayed in a way that, we can make some false judgments if we don't, really get deep into it. So, so when, and I haven't had these conversations, which I probably should have, but, it's been since this all first hit. And when this first hit, at least the advice that I got from, the physicians that I know that I had conversations with, again, so I had to be proactive with this. And, just like you and I both believe in being proactive, not after the fact with our health, and just doing everything that we can with preventative of health measures, right? So that way, we can go out there and again, be proactive as possible. And I don't look at it as it's my doctor's responsibility to take care of my health. No, it's my body. This is my vehicle for this life. It's my responsibility. I'm going to make sure I'm educated. I'm going to do what I need to do. Right. But so when this hit, it was like, okay, I'm going to try to be proactive with this. And, there's a few things that I got told across the board. And again, now that we have more knowledge and understand this more, there might be some things that aren't accurate with this, or that have been added to this that you'd recommend and so forth. But was again, to be proactive with this, to plan on getting it, and then making sure that you get through this safely, and hope if we do this right, like we don't even know that we had it, right? Which is 5,000 IUs minimum a day of vitamin D3. Now, vitamin D3, you got to be careful with, because you can take too much of it. That's why you talked about the blood work and so forth. But D3, when I say a healthy dose of vitamin C, I've been told, different ranges on this. Everywhere really, for at least my body weight, anywhere from 3,000 milligrams to 6,000 a day. I think the highest I was told is about 20 milligrams per pound of body weight as far as of a calculation for this. And again, this was in the beginning phases of this. Then from there, keep your body fat, do everything you can to keep your body fat low. Remove toxins from your diet, so less alcohol, like again, just reducing inflammation, keeping your immune system heavy, or healthy, getting a good sleep every night. And then, because it is a virus that attacks the lungs, doing some breath work, like making sure like your respiratory system is healthy with that. And then that could mean extra cardio. That might be more kind of Wim Hof style, however you want to look at that. That's what I was kind of told in the beginning. Now, with those, would you say that is still today good advice, or is some of that stuff that you don't agree with?
Yeah, I don't think any of that's bad advice. And to your point, I mean, the same things, I'm doing the same things. So, my D3 levels are always in check. I did add more vitamin C, and I dose that 2 times a day at 2 grams, but that's something that you're going to have to work up to. If you're not used to taking vitamin C and you take 2 grams, you're probably going to crap your pants. So work up to that. You can start, if you're a small person, maybe 150 pounds, start at 250 milligrams a day, and then work your way up. I would dose it multiple times a day, probably 2, twice a day, because the blood levels are pretty transient on that. They get absorbed and then, they're out. But a gram twice a day is pretty good dose, unless you feel that you're positive with COVID, then you could certainly up that. And I think there's some data that suggests that. I don't remember where I saw that, but always a good idea. In the link that we're going to post with the chat, there's a group of critical care physicians that have come up with some protocols, and that's the Frontline COVID Critical Care Alliance. And they have some nutraceuticals in there too, and one of those is melatonin. That's another thing that I take all the time. It does have some specialized antioxidant properties. And then magnesium is another big one for me. But I think zinc is something that we always should throw in when we're talking about immune system. And to kind of supercharge zinc and make sure it's absorbed and utilized properly, you could throw in quercetin on top of that.
Yep, love it. And then with D, or vitamin D3. So because it's a tiny little pill, super inexpensive to get. And to your point earlier, when we've had our conversations over the years, with all these optimal health physicians that, for a living, they're reviewing blood work all day, every day, thousands and thousands of blood labs that they've read over the years. I know that you're probably up in the thousands at this point of people's blood work. That I always have you look at all my blood work and so forth. But you don't really talk to optimal health physicians that aren't, at least in my experience, my conversations was not. It's like it seems to be the commonality. Everybody today seems to be deficient in that. But there can be too much. Right. I actually have a question from Vlad. 1,000 IUs of D3 per day, is that too much? I like the range that, according to my blood work is, I take 5,000 per day, and that seems to be, in alignment. But I know you can have too much. Is blood work the only way to know if you're getting too much of that, or are there other indicators? That people like, okay, if you're experiencing this, like to watch out for, or what are the dangers? Like I don't think people really understand D3. I don't even know if I fully understand. It's a steroid at some point, right?
Well, yeah, it's a steroid, but a steroid is just defined as a hormone that carries, a hormone. But yeah, there's some variables in there, right? That would be your exposure to sun, your skin color, how much melanin your body normally produces. For example, a black person or a Hispanic person with a darker skin is going to have less natural vitamin D production because they have more protection from your skin for D. Somebody who's a super white ass dude like me, I walk to the mailbox and I probably get my full dose of vitamin C for the month, because I don't have any protection. But that being said, that's why I always encourage you to get blood work done. Blood work, you can go to somewhere like Direct Labs online or Private MD Labs online, order yourself a vitamin D test, and then have it checked. That's really the only way to titrate dose. It is a fat-soluble vitamin, so you theoretically can take too much, and at some point it becomes detrimental in your body. That being said, if you just want to take it and make sure, 1 to 5,000 IUs once a day is probably going to be in a range that is going to get you to an effective level, more like 3,000 to 5,000. It's going to get you into the range of being effective if you're deficient, and definitely not at a toxicity point at that point. So if you don't want to go through the blood test route, all that, I would probably dose 3 to 5,000 IUs a day, once a day, and be done with it.
Yeah. And who I can't remember her last name, but Dr. Rhonda something. She's on Joe Rogan's podcast a lot. Yeah, I watched an episode that she had with vitamin D3, like since COVID's taken place, and the correlate. I mean, there was some interesting stuff, man. I highly recommend people watch it. But I think that she, was really advocating men and women right about that 5,000 IU marker per day. Where like you can't, like you get above that, you start taking 10,000 a day. That might be that kind of danger zone for some. But she seemed to think that 5,000, like my wife does 5,000 a day too.
Well, there's a doctor that you and I know, a very famous anti-aging doc, and he'll have people doing 20,000 IUs during the course, like if they have flu or something like that for a short period of time. So you can build a toxicity to it, but it's for a larger dose for a long period of time. So 3,000 to 5,000 IUs for almost anybody is going to be an effective dose and not build a toxicity level. But then again, I say that with a caveat. Always, you check it with blood work. Even if you're going to start now taking D3, that's cool. When you're doing your blood work next, which should be at least biannually, just throw it in there. It's a cheap addition, and then for sure. If you're taking D3, and this is one that we've dealt with before, if you take D3, you get blood work done and it shows it's good, does that mean you can stop it? No. That just shows you that the dosage that you're taking is correct. So it's not like you build it up and it's good forever. That's something that, and it will change seasonally. If you're exposed to sunlight, and you wear sunscreen all the time, there's some variable factors in there. So summertime, you might titrate down your dose based on your D level and sun exposure. So, there's some variables in there.
Yeah, Vlad says thank you. I thought you guys had said 500 IU. Yeah, you got it, my friend, and great to hear from you, man. It's been about a month since we talked, dude. So good to see Hope All is amazing, man. Yeah, dude. So then, when it comes to going, that's really talk about supplementation and so forth. When it comes to working out, I mean, maybe this is a stupid question, but is there things that from a workout perspective, because it is, respiratory related here, are there things that, people might want to switch up, maybe doing a little bit more cardio, or is maybe doing a little bit of breath work adequate? Like what are ways to try to strengthen that potentially? And again, I know that this is new. We don't necessarily know enough about it per se. I know I don't know enough about it, to answer these questions confidently, but what are some things that you're doing there, recommendations or things that you're hearing and seeing there?
I really don't. I don't have any idea what you could do to, further strengthen or, maybe prevent an infection in the respiratory system. I think, we should all be doing more cardio because cardio is going to help keep us, for the most part, generally speaking, cardio is going to make us leaner. And it's good for you. I mean, I've always done cardio, even when I was, trying to get as big as possible and at my heaviest weight, because it made my body work better, made digestion better, it kept me feeling better, recovered faster. And so, me, man, I'm a big proponent of doing cardio. Doesn't have to be every day, but on a regular basis. And I believe that helps you stay healthier overall. Now, if you want a 2-for-1, go outside, get a little sun, and do some cardio. That would be even better. And as we've talked at nauseum before, one of the best strategies you can do if you're not doing anything now to implement that and to start to lose weight and to improve your health is just do a 10-minute walk a couple times a day after every meal, or even after dinner. That's a great way to start. Get some sunlight, be outside, get some fresh air. You're moving your body through space, which is a little bit better than being on a cardio machine. And, I believe it's going to improve all aspects of your health. Specific work for your bronchioles and all that stuff, I'm not really sure of that. I don't know.
Yeah, and I think there's not enough data for. I don't think anybody knows right now. I haven't been able to find any answers to that at this point yet. Okay, so we got a question here. When you say breath work, what does that look like? How can I get started working on my breath work? So, do you want me to hit at this first, and then Jim, you can
go ahead.
Second. Okay,
I'm not very well versed at all.
Yeah, so I mean, there's a lot of different elements that you can do with breath work. I recommend, there is a gentleman named Wim Hof. I don't know how to spell it, WIMHOF or HOFF potentially. And he's kind of known as the Iceman. He does a lot with the cold and so forth. But there's a lot that he does with breath work. He's got a free app that I recommend. It's what I go through every day. There's just a series of different breathing exercises where essentially you're doing 30 inhalations, exhalations, and then you're holding your breath as long as you can, and that essentially counts as a set. But at least to my knowledge and the experts that I've spoken to when it comes to lungs, the lungs, most people shallow breathe all throughout the day, especially those that are not active, that aren't working out, that are active with this. And one of the issues when you shallow breathe is you can develop these little air sacs in the lungs. And also, guys, when it comes to breath, like to breath, a lot of our toxicity elimination is through through breathing, right? So this is why when you're drunk or whatever, people can smell that on your breath, right? At least from the experts that I've spoken with, I'm not an expert in this space, but you actually release more toxicity out of your breath, you're exhaling it, than you actually do through your sweat. So, a lot of different ways to do breath. I mean, a very simple thing to do, and an exercise that I do, I don't know, about a dozen times a day. I'll do this before I go into any different meeting, or I'm kind of having any pivot transition of an activity or even a mental space time, is the 4-7-8 breath. So I'll just do like 4 of these where I breathe in for 4 seconds in a full diaphragm breath, meaning you should feel it not just in your belly, but it coming up. So I'm coming in. But then you get that, so it's not just in the lower part of the belly where you're breathing in deep enough that it comes up here to the diaphragm. So, deep breath for 4 full seconds, hold that for 7 full seconds, and then breathing out for 8 full seconds. And just a slow breathe out, just pretend like you're blowing through a straw. And I'll tell you, man, you do that 4 times. You just want to reduce stress, reduce anxiety throughout the day. You're just getting out of a stressful work day and you're getting ready to walk into your house to invest time with the family, and you want to get into a different frame of mind. Just doing 4 of those very quickly, it just does something. And again, I'm not an expert in this space. I do a lot of breath work because I have, experts that I know that have sold me, I guess, on the fact of doing it. I don't know how it's improve my overall health per se. I haven't seen KPIs or indicators my blood work improve from it. But I can tell you that, overall, I feel better when I do it. So for your 4-7-8 breaths is a great place to start. And then Wim Hof, again, that app that he has. I'm up to the point right now where I'm able to hold, I can hold my breath. My record right now is 5 minutes and 30 seconds. And that's now you're doing 30 quick inhalations. So it's kind of not a full hyperventilation, but you're prepping yourself to get to there. So it's not just gulp in, go underwater for that. When I started this, I was like 90 some seconds, maybe 2 minutes at the max. And it didn't take but just a few weeks to get to that point where, you're holding that, but it allows the oxygen flow in the body. Wim Hof will go much deeper into all of the benefits, but that dude's a freak, man. So when I say that, in a good way, so he's actually went and had people who didn't believe. I mean, he set all these Guinness Book World Records of what he's been able to do with his body, but they've actually injected live viruses into his body And then through controlling it to his breath and control, like he can control his own heart rate, like, through this and his breathing exercise, but he's been able to get his body to reject the viruses that they've injected him with. And then, these physicians and these, medical science teams are like, well, you must just be a freak of nature, let's just say. So then he brought in, mentees of his, students of his, and they all got the same result. So there's something to do with, lessening and preventing disease and so forth through breath work. Again, I'm not an expert on it, so I can't speak to it at a high level. I'm just a follower of it. I'm not the teacher on this, but those are a couple great places to start that might be helpful.
Yeah, just to end on that, the only thing that I've seen as far as data is concerned, or that I've looked at, where you can increase the strength of your bronchioles and quote lung strength, is the device that Boss Root makes. It's a trainer that it's not just a mouthpiece that provides resistance, because there's a difference between the one that he makes and most of the ones that people use, but that one's actually makes it harder for you to breathe in, and there's no resistance of you breathing out. And that's the one that I've seen, at least clinically, make a difference. I started using that when I started scuba diving again, just to make sure that my lungs were in good shape, and it seemed to make a real difference. The other thing that I'd like to add on that is breathing through your nose more. There's a guy that talks about that. It's written a book about it, Breathe. And you might have seen him on social media. It's the guy that tapes.
I was gonna say, I got the lip tape. I got it all, man.
Yeah, and so for me, breathing through my nose when I sleep makes a huge difference, and doing it throughout the day, I think, makes a big difference too. And learning how to breathe. A lot of people don't know how to breathe properly, and that's breathing with your diaphragm, filling up the lower part of your lungs first, and then the upper part of your chest last. But there's a lot in there, man. But Wim Hof covers all that stuff too.
Yep, awesome stuff. So then let's kind of pivot, dude, into, so we talked about, diet, exercise, and this might be controversial, what I'm about to say here, but it just, I'm not trying to make it be, this is just what makes sense to me with this of, if you look at, I look at, with a vaccine, it's like, okay, like you and I, we got the chickenpox when we were kids because they didn't have a chickenpox vaccine. My 3 kids, they had the chickenpox vaccine. They don't have chickenpox. I don't see kids getting chickenpox anymore. Right? Where, with what we have in place now and people getting it, 6 months after they got, whatever it may be, whether you want to, it may still fall under the vaccine bucket. I'm not versed on that, but it almost appears to be now with boosters and so forth as maybe an effective treatment or potentially effective treatment versus just your traditional vaccine, right? Like a polio vaccine where now you don't really see polio, whatever that may be. And so with that being said, there are other alternative treatments. Like one of my teammates in my real estate company, he just got COVID-19. Him and his family, these poor guys, they just booked a vacation to Hawaii. They were getting ready to leave. The day before they had to go, like the night before, whatever, or maybe it was even the morning of, I can't remember, but it was like right before they were leaving, they had to go get tested to be able to fly into Hawaii. The whole family had COVID-19. So had to cancel their trip. He just got done with the 2-week quarantine, all of that. He's back in the office now. Just ran. I hadn't seen him for like 2 or 3 weeks. But I was talking to him about what he went through, what he experienced, how he felt, all of that, how he's feeling now. And, he was talking about with going to his doctor. His doctor didn't have him or recommend the vaccine for him or his family. And this guy's early 30s, right? Young kids, he's young. So maybe because of that, whatever, but instead they put him on a different protocol with, I think ivermectin. So I don't think it was ivermectin. I believe, prednisone steroids for the lung inflammation, or lung inflammation. And I can't remember if there was other things mixed in there, but there's other, and this was, his doctor was a big proponent on it. And I've also heard others that have said like, hey, I tried to go to my doctor to get the vaccine, but they won't prescribe it. They won't issue it. Like you got to go to, wherever they're publicly doing it. So there seem to be other effective treatments that are taking place out there. And I know that this is something that you've done a lot of research on, and spent some time, with that. So what are some other measures that you're seeing out there that seem to be effective, if you do get it?
Well, again, I'm going to fall on this link that we posted up, and that's the Frontline COVID Critical Care Alliance link, and that's a group of physicians that have been dealing with dealing with patients since the beginning, and they've been very open-minded and using everything that they could get their hands on to make a difference for their patients. And this guy's been on multiple podcasts trying to spread the news, and that's a great source if you want to go in and try to explore some of the different treatments and protocols that they use. A lot of that has to do with ivermectin, and that's one of the things that interested me early on, because I was not in line first to get the vaccine. I wanted to wait a while and kind of determine if I really needed it, if I wanted it. First of all, too, I didn't want to get in front of anybody that really kind of, in my opinion, needed it more than I did. So, that was a 7 month pause period. But that being said, my concern is I don't want to have it not be non-symptomatic and be spewing virus all over the place on everybody, especially if I'm working around healthcare workers. I want to make sure that I'm not, in a contagious state, walking around, passing it on to people. So ivermectin was interesting to me in that aspect. And early on, we started dosing it, and there's a protocol in there to dose it so that, according to the data, that you're not a super spreader, or you're not shedding virons all over the place everywhere without noticing it, or being part of the problem of why we're not shutting this down supposedly as fast as we should. That being said, there's a lot of information on there for people to go through. I'm not a physician, but I can tell you what I'm doing now. I'm waiting on my second shot of the vaccine. I've been taking ivermectin in the one of the protocols outlined in that link, and that's to kind of supercharge your immune system, or to, I don't know, I shouldn't say that, to kind of prevent any exposure that you get, or the best preventative dose, and that's 18 milligrams a week, and that's what I take. We have it on hand if anybody in the family gets sick. Obviously, we would start dosing it, and I think that is at least keeping me in position where I'm not spreading it, and I'm as safe as I can to be exposed to it and not get it. Whether you're a fan of the vaccine or not, I don't know. That's not for me to say. I don't know. We talk about the flu shot too. That's a flu, in essence. That's a flu vaccine, right? But depending on the year and how much the virus has changed from when we start making that, once it starts in China and by the time it gets to us, the lowest I think that I've seen it is a 7% efficacy rate. But the idea is that I think the big idea is that you don't want to be contagious. I think that the idea is with getting one of the vaccines is to not make you as contagious when you get it, and obviously to lessen the symptoms and how how ravagedly you get affected by it, if at all. So I don't know, man. There's a lot of things that are very strange about this and not. But that being said, I would encourage everybody to go through this. It's not. I mean, it's pretty clinical, but the protocols and things are very simple. They're very straightforward. They're very laid out. Ivermectin I've used before. Very strong dose for a very long run for my rosacea to see if that helped. So I've used it before, and I think it's pretty side effect free. It's pretty I don't want to say side effect free, but it's a pretty benign medication unless you're a parasite living in our body. So that being said, some physicians won't prescribe it, and some will. Some of the anti-aging doctors, like the one that I go to, has a portal set up that if you want to get a ivermectin prescription, you just pay a fee, fill out some forms, and have a consult, and he'll write it for you. So there are physicians out there that will do it, and like you said, this guy's family physician put him on a protocol. So the word is getting out there. I've known a lot of people that have gone to their physicians that have had it, and they've been on a course of ivermectin. I also have heard I wouldn't say countless, but we're above 10 stories of people that suffered pretty severe side effects from the second dose of the vaccine, and they've had kind of the lasting COVID symptoms hanging on afterwards that shouldn't have. And the ones who are being treated successfully and passing through that, getting rid of it, are the ones that have physicians that are prescribing ivermectin runs. So in my opinion, that's something that I personally am going to take, and I have on hand for anybody in my family who gets sick. And I really think that it should be a frontline defense. But I'm not a physician; I don't prescribe it. This is just my opinion.
Yeah, yeah. And what I like about this is at least the shit I paid attention to or watched or listened to, it seems to be like the different camps, right? Like, like you got it, it's the ivermectin protocol versus the vaccine, right, and so forth, where, it sounds like they can effectively potentially be used together if that's a path you want to go down. Like I personally, choosing to not get the vaccine, but I also, dude, I haven't had a flu vaccine ever, right? I'm sure maybe when I was a little kid, but like I'm not anti anything. I just don't know why I need to inject that in my body at this point when, like, I just don't feel the need, right? If it becomes a thing where it's necessary, my doctor feels it's necessary, okay, fine, and then I'll do it, right? So, but you're speaking from it of, hey, look, I've done both to be preventative, and this is the protocol that, so, but unfortunately, because people get this kind of either or, this almost like combat thing, then a lot of people don't put two and two together, because again, it gets this, I don't know, narrative paradigm, however you want to put it, of it's this path or this path, instead of thinking about, hey, dude, like what if we put these two together? What power could that be? Because like, oh, dude, I just had a family member, actually my stepmother, who, she got the vaccine. I mean, it's been maybe a month or so, but then now I don't know if there's correlation to it other than on the CDC website. It talks about this being a side effect of the vaccine, but she just had appendicitis. And about a month after she got the vaccine, had appendicitis, goes to the hospital. Week after that, she gets out of the hospital. Then she's in more pain than she was before the appendicitis, and that became it was I don't know, some infection that happened after the fact from the surgery, whatever. And again, it may not have any correlation, but from the people, I also have other family members that have. An uncle of mine that may end up even having to retire because of all the joint pains that he has throughout his body now. But it might be a thing of, hey man, why don't you try this with that and see if that wipes out any negative effects that have come from whatever the experience might be prior to that.
That's a discussion that they should definitely be having with their physician, and from the stories that I've heard, that's how physicians are treating a lot of those effects from the vaccine. For the people who have it, and not, that's a small percentage, but it's still people are out there. And quite frankly, I don't know if we are going to get a real clear stat on that, But that being said, this is America. I don't, we all have our opinions on that, whether you should be forced to do something or not. But, according to this data and according to some of these guys, these physicians who are putting all this stuff together, if everybody was taking ivermectin, then it would be an effective strategy to eliminate it. And I think another thing why people are so black and white on this is that people think if you have the vaccine that you're not going to spread it and you're going to stop it. And I don't believe that that's the case, and I don't think that that's what we're seeing right now. So, if you're really black and white on this issue, I just don't know if we know enough to say that that's a fact. And I know people who've had the vaccine that have re-gotten COVID. They're not as sick, they're just staying at home and don't have a difficult time with it. But, how long, they were still symptomatic. They were still asymptomatic for a period of time where they could have been contagious before they felt, oh, hey, I'm sick, and decided to isolate themselves. So.
Yeah.
I don't know. Yeah. I don't know what the answer is, but I just, like we said in the beginning, I want to make sure that I'm taking every precaution that I personally can without infringing on anybody else or expecting anybody else to be safe for me, and so I'm trying to supercharge my immune system, trying to have things on hand to take in case that I do get it, or to dose myself with the resources available to help myself, my family, and try to not make myself a danger to anybody else. And that's, back to the same thing. If you're sick, stay home. And that applied before COVID. If you're sick, you got the flu, stay home. Don't get anybody else sick. But
yeah, well, the bitch with the time that we're in, dude. And maybe this has always existed. I was thinking about this the other day. I'm like, I don't know, maybe. Like some of the shit that we're seeing and moves that we're seeing, and I think everybody's got their own belief systems and skepticisms and whatever of just all the craziness of this. Almost feels like this movie that we've been living in for some time now. Maybe this is the way it's always been. There's just now is a bigger spotlight on it, or we haven't been able to go out there and be distracted through all this entertainment, so we're paying more attention. Who knows? But it just seems, at least in my 39 years of life experience, that more than any other time that I've experienced or I have awareness of, at least in my lifetime, of I guess the division or the inability to just be able to have an open conversation, agree, disagree, whatever. But it's like, look, you and I can totally disagree on something, but we can still be homies. And I think it was Socrates that said, one trait of a wise man or a wise woman is the ability to be able to entertain thoughts, given by, I'm totally botching this, but, entertain a concept, entertain a thought without it necessarily changing your belief system. Right? It's like people are going to have opposing views, and you should be able to talk and debate and like challenge your own beliefs, and not saying that, the great Jim Rohn always said, be a student, not a follower. Yeah. Right. Like learn, but then gain all the knowledge and come up with your own, your own beliefs from that and so forth. But it just seems like it's been stripped away, where then now it's, like the protocol that you're talking about that you're doing right now. Like, dude, this seems to be like a very amazing, valid protocol. Again, everybody's got to talk to their doctor about this, but that could help a lot of people. But because of the decisiveness of picking one camp versus the other camp, it's something that people aren't, just what's blowing my mind this whole time is just the lack of even conversations, from health officials and professionals out there of just overall general taking care of your health and diet and supplementation. And, just like you're talking about here, because everybody's it's got to be one or the other versus, hey, could both of these come together and work? And maybe they do. And maybe, it seems to be working well for you. And to me, that just seems to be the smart, like just having the knowledge and entertaining, so then you can have those thoughts and have that conversation with your doctor. How many aren't initiating this conversation with the doctor because they think that there's no options?
Well, that's true too. That's true. But, to play devil's advocate again, as I often do here, if I was a physician, there's a lot of things that play into the decision-making process about what you can prescribe and not prescribe. And so ivermectin is not FDA approved for the treatment of COVID. So there's physicians that just cannot do it. And that might be, the group that they work for. It might be somebody just out of school and has really expensive, insurance. There's a lot of factors that play into that. So I don't blame physicians for that. It's just like TRT, in the beginning, 5 years ago, when we were talking about testosterone replacement therapy, guys were scared they were going to go to jail for prescribing testosterone, and now you can buy it on the street corner at these medical clinics, it's amazing how mainstream that's become. But that being said, physicians get hit with a lot of stuff with these Google patients that come in and go, oh yeah, my cousins did this and that. So I understand it's got to be, very frustrating on that part too. So like we did with testosterone replacement therapy, we had a book that was put together that you could take into your physician and go, hey, look here, this is where I'm getting this information. I know you don't have time to read it, but here's it in print. Here's the studies that back those ideas up. This is what I wanted to talk to you about, and this is what I wanted to try for myself. The link that we have is something that you could print out. You could send that to your physician. You could print out the white paper on the protocols that you're interested in taking, maybe, and send it to them, or however you're communicating with them, and say, hey, I understand this isn't FDA approved for this cause, but this is why I'm interested in it. And that helps them, number one, to determine that you're serious. You just didn't Google and read Medline Plus or something, or talk to Nancy across the street and come up with this brilliant idea that you're going to take something. But you actually did find a source. This is a source that's from clinicians that are from their peers, and something that they can read that hopefully will either open their mind or change their opinion about possibly prescribing that medication, or hopefully using it in a positive manner that's going to help their patients. So There's physicians and clinicians have a real difficult time right now. They're inundated, they're overwhelmed, they're overworked. All the people that I work with in the hospital are, you know, they are busting their ass to try to help people and keep people alive. That being said, be patient and be respectful of the time. And to do that, show up prepared, have relevant data to share with them, and be, precise with your thoughts and what you want to do. And here's the reason why you want to do it. Same with, when you rolled into a physician's office years ago or even today and you wanted to be prescribed testosterone, right? And how to deal with that and be prepared. Do a little reading and knowledge, bring yourself up to a knowledgeable level to have a discussion with them. This is why I want to do it. This is why I think I need it. Here's my lab work. I've done it ahead of time, whatever. But, make it a little bit easier for them to analyze the situation and come up with something, whether they want to risk, prescribing you something or not.
Yeah, you know me, man. I mean, everything that I have to correlate everything to business because it's just, what's on my mind 24/7 is business.
Yeah.
Not that health or fitness isn't, but, business is where I spend most of my time. And, I look at this, like I'll tell, others that reach out to me for advice on I'm like, look, you got to be you don't need to be the expert per se. But you got to be knowledgeable enough to be able to then identify who the expert is or who the charlatan is. Like we'll just say maybe you're going to go out there and start hiring an ad agency to go out there and start running, be a buyer, an ad buyer for you for Google pay-per-click, YouTube, maybe Facebook, whatever. It's like, okay, I need to know enough about those. I don't need to be the expert on those platforms, but I need to know enough to know, okay, is this agency legit? Like, what are the questions I need to ask them and vet them to make sure that they are legit? How do I know if they're winning or losing or spending my money responsibly? What are those expectations? And I look at my health in that same manner of, look, I'm not trying to be the doctor. I'm not trying to let them be but I want to know enough where it's my responsibility at the end of the day. It's not my doctor's responsibility. It's my responsibility. This is my body, my vehicle for this life. So I need to be educated enough where at least then I can go out there and identify hey, how do I know if I'm working with a great doctor or not? As an example, my son just started, all my kids just started public school for the first time this year. And one of our sons, we got a packet that he came home with that was like, okay, there was 2 vaccines that he hasn't got on there. And I'm like, okay, well, I don't know what these vaccines are. I don't know, whatever. So there was like, okay, you can come to this clinic. They're having all these vaccines plus, the COVID vaccine there. But it's like, I don't know, just a big open room gymnasium where you can come and just everybody getting. I'm like, no, I'm not going to do that, man. Not saying I'm not going to get my son the vaccines. Right. But I go to my wife. I'm like, schedule a time for a doctor. I'll take him. I'll have the conversation with the doctor. But I have a pediatrician that I trust, that we've vetted, that we've done our research on, that we've had in-depth conversations about our children's health. Right. I'm going to go have a conversation with my physician about it. He knows my child's, my son's health records. He knows, all of those things. I'm going to have an in-depth conversation. Like, what are these? Why are they needed? Are they necessary? Like, I'm going to take that time to ask those questions. My doctor is going to be the expert, the expert that I've chosen to go, for my son. And I do this with my own physicians that I work with. I got to, but have enough knowledge, I guess, if you will, to know, okay, is this person somebody you should really be trusting with your health? Same thing with your dude. Like if you're to have a 401k or you're, investing with a stockbroker, I don't need to be the stockbroker. I don't need to be the financial analyst, the financial expert, but I need to have enough knowledge and research it enough to know, am I getting scammed here or not? And what are the questions I need to be asking, right, to make sure that I'm confident that these are the right moves. And, it's unfortunately, man, we're just in a society where a lot of people just want to pass. I hear this all the time. Oh, well, I'm not doing good financially because I was never taught that stuff growing up. Who the hell was taught this shit growing up? No, like you got a brain now. You got more resources available all of us than ever before. Like you can do your own due diligence, and I believe that we need to be. We got to take this responsibility upon ourselves, at least we know that we can go trust then the right advisors. Shit, it's how I met you.
Yeah. Well, and just to add on to that and bring back a point that you made earlier, one of the best ways to, like, if you're looking to learn something, if you're politicized or you're in this black and white thinking, then it's very hard to get a full picture of what's going on because you're not going to get it being tribalized in one viewpoint. If you were trying to figure out something that happened politically, right? Well, if you were on one side and you were getting all your information sources from that side, you're never going to figure out what the issue is. You're going to figure out what that team's view is, or that view is. And same with health too. You're going to have people that, or if we're talking, we're talking about this vaccine, non-vaccine people. I think it's very important to have an open mind, talk to everybody, learn from everybody, kind of get a whole vision of the playing field, not just this tunnel vision, like, Trump made the vaccine or whatever it is, or whatever. Then you're going to miss out on all this information. And I think the truth usually lies somewhere in between, right? And then my thoughts on the doctor, we've been very fortunate to work with some of the best anti-aging doctors and, some of these private physicians. And that's one of the things that I've always encouraged people to do. I have Dr. Meehan as my private physician. And when we have something like this come up, or I need his opinion on something, that's somebody that, it costs a little bit of money, relatively a small fee, but I get to talk to him, and he is well-versed and has an open mind about a lot of different ways to deal with your health, as versus going into like a primary care physician or, a walk-in clinic. Those clinicians now, their hands are so tied. They literally are following. If you see the doctor, it's usually somebody else, an assistant, but they're following a protocol given to them by the insurance company so that they can bill properly to get paid for your visit. And that's determined from the insurance company, not like, hey, tell me what's going on. So we've lost some of that, and that's something to consider too. When you're trying to vet a physician, make sure you have one that you're paying for, that you can actually sit down and have a conversation, and it gives them time to diagnose you, and that's one of the things that's very difficult to do right now in the healthcare space.
Well, and I get, I mean, it sucks, but unfortunately, there's a lot of, there's not a lot, I don't want to say not a lot of people, but not everybody can, afford to, because you and I have chosen, okay, hey, we're just not going to play this game. Like, we go work with optimal health physicians that insurance doesn't cover, that we're having to pay out of pocket to. And, but let's just say it costs between me and my wife and my kids to do that. Maybe it's 15, 16 additional $1,000 a year. Now we still pay our insurance premiums for our other insurance in case something major happens. But I get that not everybody's in a position to be able to go out there and do that, but that's the ideal scenario, right? Because then, like you just said, man, like, our doctors, they say our blood work every 90 days, and they have for years. They know our diets, they know our supplementation plan. They're so they know. So when we're able to have a conversation on, should we go this route, what makes sense? Like, they know our bodies inside and out. Like, I know my business's profit and loss statement, and right, of they can make those smart strategic decisions. And I get not everybody's in that position to do it, but we all are in a position to be able to go out there. And most people, I guess, I don't know how all insurance companies work, but I believe, at least because I'm an employer. So I pay all my medical premiums for all my staff, and even though I don't have to do that per the state of Arizona, I have to pay a portion of it, but I choose to pay all of it. But we make sure like they get freedom of choice of who their physician is, and there might have to be still limitations of people in a certain network and that we can't always get around, but they still have freedom of choice, to within that. So you can still, regardless of your current situation, you can still take it on yourself to go out there and, figure out the right questions to ask your physician. And the right questions, I guess, to ask them are like, how certain are you that this person knows you and is paying attention to you? Are they, like, a thing that I always hate with doctors, dude, or have in the past is like, they come and everything's just rush. No, man, if they're not going to take the time to answer my questions and answer them in a way that, makes me feel confident, like that, I'm probably not going to be confident in that physician. Now, that may not always be the case, and I could be wrong with that statement, but if they're not going to take the time to answer your questions in a way that makes you feel comfortable, makes you feel certain, and I don't know, to me, that's a red flag. There's a different, that's a whole nother podcast episode, I guess. Maybe we could bring on some of our physician friends to be like, okay, here's maybe questions to be asking a physician to vet.
Well, the problem is, country doctor that has 30 minutes, 40 minutes to sit down and talk to you and diagnose you properly. Unfortunately, the constraints of medical care today, those private practices are gone because they can't financially do it. You have general practice physicians that have 100 patients in the day, doors open. Really not to, you're going to wipe out half the people anyway if they're there for a runny nose or a cold. But somebody who has, a slight, little more complicated diagnosis, it's very hard to do that to our patients today. These days.
Yeah.
That's
awesome stuff.
Podcast.
Yeah. Well, with that being said, I know we are clicking over to just a full hour, which is longer than our normal session. But we had a lot we wanted to cover today, and truly appreciate you guys being here, watching, tuning in. For those of you that are watching live, this platform Restream that we use to stream these live, it's not allowing me to share the link that Jim was referencing to. So I'll give me about 20 minutes. I'll have it posted manually, so you guys can see that in the comments. We'll have comments details. You guys will see all that posted in there. So we'll have that in there. And again, thank you guys for checking this out. Thank you guys for watching this. Make sure to check out FORJLife.com, our sponsor of the show, our sponsor, and Jim and our supplement company. A lot of great supplements on there to help you guys on this optimization plan and to go out there and optimize your overall mental, physical health, and so forth. So check out FORJLife.com. And as always, thank you guys. Jim, appreciate you being here, brother.
Thank you. Good to see you.
All right. You too, man. I'll see you guys next week.